Good afternoon to all and welcome in today's session. In today's session, we are going to discuss the remaining part of your pharmacokinetics and some part of your pharmacodynamics. So in this lecture particularly, we are going to focus on the elimination process, how drug is eliminated from your body and different type of receptors, different type of drug receptor interaction, their terminologies, agonist, antagonist, etc. and few part of your pharmacodynamics. After drug absorption, after its distribution, after its metabolism, the drug should be eliminated from. It should be eliminated from your body because drug is nothing but it is a foreign to your body. Okay, it is a chemical synthesized in the lab, so it is a foreign to your body. It should not remain in the body. So it has to be excreted. It has to be thrown out of the body. So what are the different ways to it? So there are different organs. Those are engaged in the elimination process of drug. Drug may be eliminated either unchanged. ओके तो जैसे आपने एसिटिल सैलिसिलिक एसिड दिया तो एसिटिल सैलिसिलिक एसिड वैसे भी रिमूव हो सकता है या फिर उसका मेटाबॉलिज्म होके मेटाबोलाइट बनके भी रिमूव हो सकता है. So drug can be either removed from body as it is or unchanged or either in their the form of their metabolites. Okay, so अगर उनका मेटाबॉलिज्म होता है तो वो मेटाबोलाइट बनेंगे और नहीं होता तो वो unchanged. So drugs and its metabolites are excreted in different ways. So first major route of elimination for the drug, it is nothing but the urine. So that's why the aim of your metabolism is to make a lipophilic drug into hydrophilic drug so that it can be easily excreted. So that is the one of the most important route of elimination, that is the urine. Okay, so most of the drug they are eliminated by urine. They are eliminated in the form of their metabolites in the urine. Okay, then another feces. Some drugs are also excreted in the feces, like erythromycin, ampicillin, rifampicin. So these drugs they get excreted in the feces. So they will color your feces. Sometimes what happens, आपको किसी ने कोई डॉक्टर ने दवाई दी तो उस टाइम पे क्या होता है, आपका जो फीसेस है जब टॉयलेट में जाते हो आप समझ में आता है यार ये तो ऑरेंज कलर का होगा, ये तो ग्रीन कलर का होगा. So that is nothing but the drug is being excreted in that part. In case of exhaled air, exhaled. So inspiration, what is inspiration? To take air inside the lung. Expiration means to release the air. Okay, so that air is nothing but the exhaled air. In that also some drugs are excreted. So for example, volatile anesthetics, alcohol. तो अगर किसी ने अल्कोहल का ड्रिंकिंग किया है तो इजीली समझ में आता है उसका, क्योंकि स्मेल आता है. क्यों स्मेल आता है? उसका जो ब्रीथ होता है वो ब्रीथ में वो अल्कोहल एक्सक्रीट होता है. दैट्स व्हाई वहाँ पे आपको समझ में आता है इसने तो वो ड्रिंक करने के बाद जो पुलिस चेकिंग करते हैं उसमें भी वही फॉर्मूला रहता है. वो जो डिटेक्शन होता है वहाँ पे वो दैट विल डिटेक्ट द percentage of alcohol present in your breath. Okay, so that means alcohol is excreted in the exhale. Some drugs are also excreted in the saliva, sweat, etc. For example, lithium, rifampicin. There is one drug known as metronidazole. If you are suffering from diarrhea, patient will prescribe you metronidazole tablet. Metronidazole का tablet होता है तो उसमें जो metronidazole होता है, so that drug will be excreted in your saliva, and that drug, because of it is excreted in the saliva, that drug impart a very bitter taste and metallic taste in your mouth. तो आप जब भी मेट्रोनिडाजोल का टैबलेट लेते हो तो आपका जो माउथ है उसमें एक बिटर इंटेंस मेटालिक टेस्ट आता है. तो आप बोलते हैं ये क्या हो रहा है, मेरा मुंह खराब हो गया. That is not a thing, because that metronidazole is being excreted in the saliva. That's why it is having metallic. Few drugs are also excreted in the milk, gallbladder. So there are different ways to eliminate the drugs. Okay, so but the major route of elimination is the urine. Okay, then second one is feces, third one is the exhaled air, fourth one is your gallbladder, and then saliva, milk. So we'll see that one by one. So what is the process of elimination? What is elimination? Elimination is nothing but the removal of drug and its metabolite. Removal of drug and its metabolite from the body, mainly by renal excretion. So that is the major route of elimination. So elimination is nothing but the removal of metabolites and drug from the body by process of renal excretion. Along with this renal excretion, other organs are also responsible for the removal of drug. That is elimination. So these are nothing but the lungs, biliary system, intestine, salivary glands, sweat glands, as we have seen the previous slide. So now, elimination, the rate of elimination will be decided by the physicochemical properties of drug itself, the overall status of your body. whether your kidney is working good or not. Age, there are different factors related to affecting on the elimination. There are different factors of rate of elimination and elimination product, as like factors affecting on the absorption, distribution, matter. So there are certain factors which affect the elimination also. So I'm not going to discuss those factors because those you can read from any book. So what is glomerular filtration rate? So amount of water or amount of drug with blood filtrated by glomerulus per unit time. It is known as a glomerular filtration rate, GFR, glomerular filtration rate. Okay, and it is closely related with creatinine clearance. The creatinine filtrated. So that's why this creatinine clearance means amount of creatine cleared per unit time from the glomerulus, okay, is equal to the amount of water filtrated from the glomerulus. So that's why glomerular filtration rate is closely related to creatinine clearance. Okay, and this was the question in GPAT 2000. Creatinine clearance is equivalent to glomerular filtration rate. Again, this glomerular filtration rate GFR is also measured by using inulin clear. There is one polysaccharide, homopolysaccharide. It is a homopolysaccharide known as inulin. Okay, so this inulin is used to measure the glomerular filtration rate. Okay, GFR. What is the normal glomerular filtration rate? It is a 20 to 30 ml per minute. Normal healthy person will have 20 to 30 ml glomerular filtration rate. Okay, so it is closely related to creatinine clearance, and also inulin is used to measure the glomerular filtration rate. Is that clear? The sum of individual clearance by all eliminating organ is called as a total body clearance. Clearance of drug from kidney, clearance of drug from your lungs, clearance of drug from your other body parts like salivary gland, intestine, bile district. So total sum of these clearance means elimination. So clearance means elimination. So all the sum of individual clearance eliminating organ, and it is known as a clearance of total clearance of body. So total systemic clearance. Sum of all the clearance by individual organ, it is known as a total systemic clearance. Is that clear? Now clearance, it is a, what is exactly the clearance? So it is a hypothetical volume of body fluids containing drug. So drug is absorbed, it is present in your different body fluids, blood, extracellular. What is clearance? It is a hypothetical volume of body fluids containing drug from which drug can be removed or can be eliminated or can be cleared completely in a specified period of time. That is nothing but the clearance. Okay, this is a hypothetical volume of body fluid containing drug which is to be cleared or which drug is removed in a specified time. That is nothing but the clearance. Okay, and this clearance is expressed as ml per minute. Okay, this clearance is expressed as ml per minute. For example, your phenytoin has a clearance of 1.5 ml per minute, and it is the constant for any given plasma drug constant. हर एक के लिए एक constant होता है, हर एक ड्रग का एक constant होता है, clearance constant. तो हर एक ड्रग उतने ही clearance में निकलता है बॉडी से. So it is nothing but the clearance. How clearance is determined? How it is calculated? So clearance is nothing but it is equal to elimination rate divided by plasma drug concentration. So clearance is calculated by elimination rate divided by plasma drug concentration. Is that clear? Renal clearance. So it is the volume of blood or plasma which is completely cleared or change in the drug by kidney per unit time. Volume of blood or volume of plasma which is completely cleared by the kidney per unit time. It is nothing but the renal clearance. So whatever is this clearance is nothing but the total clearance. Okay, this clearance is nothing but the total clearance. We have not specified any organ over here. So it is just clearance. Now this is renal clearance, means clearance via kidney. So rate of urinary excretion divided by plasma drug concentration. So renal clearance is equal to rate of urinary excretion divided by plasma drug concentration. Is that clear? It is a clearance. We will see the next. So here are the excretion pathway, transport mechanism and different. So here we have different routes for excretion. So जैसे absorption के लिए different routes होते हैं, वैसे excretion के लिए भी different routes होते हैं ना. All excretion routes are like urine is there, bile is there, then lungs are there, saliva, milk and sweat and intestine. Most of the drugs are eliminated in the urine, then bile, then lungs, then saliva, milk, sweat. So what kind of drug are removed in the, or what kind of drug are eliminated from urine? Free hydrophilic means water soluble drug. Which drugs which are the free and water soluble? Means if there is a protein bound drug, so that will not be filtered. Okay, that will not be eliminated. So until it is free, it cannot be eliminated. So if there is a protein binding of drug, that will also decrease the elimination. We have seen this in the previous when we were studying the drug deposition, that is metabolism. If drug is in a free form, if it is hydrophilic or it is a water soluble or it is a ionic, ionizable, then only it can be filtrated through urine. Okay, so that's why free hydrophilic unchanged drugs or their metabolites, free drugs or their metabolites or the conjugates of drugs, okay, like glucouronide conjugate, sulfate conjugate, all these are the excreted in the urine. All these are the excreted in the urine. Okay, those drugs which are having molecular weight less than 500 daltons, those can be excreted. Now, what is the mechanism? Excrete them. So there is a glomerular filtration. Then again, active secretion is there. Active passive reabsorption is there. So if you know the process of urine formation, if you know the process of urine formation, you will easily understand these words. Glomerular filtration, active secretion, reabsorption. See what happens. Normally, आपका जो किडनी है, वहां से आपका ब्लड फिल्ट्रेट होता है, वहां से सब कुछ फिल्ट्रेट होता है इनिशियली. ग्लोमेरुलस जो होता है आपका, वहां से सब कुछ फिल्ट्रेट होता है इनिशियली, सिर्फ ब्लड सेल छोड़ के. ओके, ब्लड सेल रहेगा हुआ, बाकी सब जैसे ही फिल्टर होके नीचे आता है, वहां पे आएगा आपका प्रॉक्सिमल कन्वोल्यूटेड ट्यूबुल, उसके बाद आएगा लूप ऑफ हेनले, डिसेंडिंग लूप ऑफ हेनले, उसके बाद आएगा असेंडिंग लूप ऑफ हेनले, उसके बाद आएगा डिजिटल कन्वोल्यूटेड ट्यूबुल, एंड उसके बाद आएगा पीसीटी में जो न्यूट्रिएशन होता है आपका, विटामिन, जो न्यूट्रिशन, ग्लूकोज वगैरह, वो सब अमीनो एसिड्स, जितने भी आयंस लगते हैं, वो सब रीअब्सॉर्ब हो गए. कहाँ से? योर पीसीटी, डीसीटी, लूप ऑफ हेनले, देन डीसीटी एंड देन कलेक्टिंग डक्ट. ओके, ठीक है, लास्ट में होता है कलेक्टिंग डक्ट. इसमें से सबका वाटर का रीअब्सॉर्प्शन होता है. नहीं तो ऐसा तो होगा कि ब्लड से फिल्टरेट ही हो रहा है और रीअब्सॉर्प्शन नहीं हो रहा है, तो फिर आप ऊपर से पानी पीते जाओ, नीचे से छोड़ते जाओ, तो वही तो काम रह जाएगा ना. तो देयर शुड बी रीअब्सॉर्प्शन. ओके, whatever is required for the body, so there is a reabsorption of. So drugs are also filtrated, some drugs are also fully secreted. मींस अगर reabsorption भी हुआ उसका, फिर भी उसको अंदर बॉडी को समझ में आता है कि उसको लेना है, बाहर फेंकना, उसको एक्टिव सिक्रेट करते हैं. पैसिव reabsorption भी होता है उसका. So those kind of drug which are hydrophilic, water soluble, unchanged, metabolites of the drug and conjugates of drug metabolites, they are eliminated or secreted in the urine. Now let's come to the bile. So you have bile in your gallbladder. Bile is nothing but your three sorts of bile: sodium tauroplate, sodium glycine, and this bile is very important for emulsification of your fats. Okay, so this bile is very important for absorption of fats. So, after emulsification, that is absorbed in the intestine. Some drugs are also eliminated in the bile, excreted in the bile. So that's by active secretion. They excreted by. So which kind of drug are secreted? Hydrophilic, unchanged drugs and metabolites. Their conjugates having molecular weight less than 500. Then again, lungs. In case of lungs, so which kind of drugs are excreted in the lungs? So gaseous, volatile, general anesthetics, alcohol, as I assumed, some other drugs which are insoluble in the blood and other tissues. Such kind of drugs are excreted in the lungs. In the saliva also, by passive diffusion and active transfer, drug is excreted in the saliva. So which kind of drug? Free unionized lipophilic drugs, they are excreted in the saliva. मैंने एग्जांपल दिया था. अगर आपने एंटीबायोटिक लिया या फिर अगर आपको डायरिया हो गया, उस टाइम पे आपको फिजिशियन मेट्रोनिडाजोल का टैबलेट प्रिस्क्राइब करता है. और वो टैबलेट क्या होता है? मेट्रोनिडाजोल, द ड्रग which will cause a metallic taste or bitter taste in your mouth. लेकिन why? There is a reason. The drug is excreted in the saliva. That's why it causes the metallic taste in the. Some drugs are also excreted in the milk. So what kind of drug you can easily predict? So lipid soluble drug which can be excreted. क्योंकि मिल्क में क्या होता है? सब कुछ मिल्क is a emulsion. Okay, so free unionized lipid soluble drugs, they are excreted in the milk. And also in the some drugs are also in the sweat. Free unionized lipid soluble drugs. Intestine में भी होता है water soluble and ionized drug. So these are the nothing but the different routes for the excretion of drug. Okay, urine, bile, lungs, saliva, milk, and sweat glands, and your intestine. Now we see the next. So what are the kinetics of elimination? There are two kinetics of elimination. Drug either may be eliminated by zero order elimination or drug may be eliminated by first order elimination. In case of zero order elimination, so for example, take an example of ethanol. So those drugs which are highly soluble and highly permeable, those drugs are eliminated by zero order elimination process. So what is zero order elimination process? So and in the zero order elimination process, a constant amount of drug that will be eliminated per unit time. मान लीजिए कि आपने इथेनॉल 20 mg per 100 ml per hour. It is a constant. Constantly वही amount उसका रिमूव होते जाएगा बॉडी में से, उसको बोलते हैं जीरो ऑर्डर एलिमिनेशन रिगार्डलेस इट्स प्लाज्मा ड्रग कॉन्सेंट्रेशन, कि इतना ही ड्रग रिमूव हो जाएगा पर यूनिट टाइम, अरे ओवर में डजंट मैटर आपका प्लाज्मा में कितना ड्रग है, कांस्टेंट अमाउंट ऑफ ड्रग इज एलिमिनेटेड पर यूनिट टाइम रिगार्डलेस इट्स प्लाज्मा ड्रग कॉन्सेंट्रेशन, प्लाज्मा में कितना ड्रग है वो कोई लेना देना नहीं, ऐसे काइंड के ड्रग जो होते हैं वो जीरो ऑर्डर एलिमिनेशन फॉलो करते हैं, दोस काइंड ऑफ ड्रग्स फॉलो जीरो ऑर्डर एलिमिनेशन, इन दिस जीरो ऑर्डर एलिमिनेशन कांस्टेंट amount of drug will be eliminated per unit time regardless its plasma drug concentration, right? So there is also equation dc upon dt is equal to ke. So dc means decrease in the concentration or change in the concentration, dt means for the time is equal to ke. It means elimination rate is equal to change in the concentration per time per unit time, change in the concentration per unit time is equal to elimination, right? This is a zero order elimination. So whatever is given in the red color, that is a graph of zero order elimination, means constant fraction of drug will be eliminated per unit time regardless its plasma drug concentration. It is very important. यहाँ पे initial concentration कितना है, drug concentration कितना है blood में मैटर नहीं करता, constantly एक fraction remove किया जाएगा body में से, so that is nothing but zero order elimination. So in case of first order elimination, so amount of drug will be eliminated per unit time which is proportional to the plasma drug concentration. So now amount of drug eliminated per unit time which is dependent on your plasma drug concentration, that is nothing but the first order elimination. So first order elimination में क्या होता है, फॉर मान लीजिए कि आपके ब्लड में concentration ड्रग का बहुत ज्यादा है, उस टाइम पे रेट ऑफ एलिमिनेशन भी ज्यादा, जिस टाइम पे आपके ब्लड में concentration ज्यादा है उस टाइम पे जो एलिमिनेशन का रेट है ड्रग का वो भी ज्यादा हुआ, जैसे जैसे concentration ब्लड में कम होते जाएगा वैसे वैसे एलिमिनेशन रेट भी कम होते जाएगा, जैसे जैसे concentration कम होती जाएगा ब्लड में वैसे वैसे elimination rate कम होती जाएगा, that is nothing but the first order kinetics. So amount of drug eliminated per unit time is proportional to the C means that is the concentration of drug in the plasma. First order kinetic का derivation है dc upon dt is equal to KEL, that is means change in the drug per change in the concentration of drug per unit time is equal to elimination rate into plasma drug concentration. So यहाँ पे plasma drug concentration है, यहाँ पे नहीं है, so it is a concentration dependent. Okay, this elimination is first order elimination is a concentration dependent. Okay, zero order elimination is not a concentration dependent, it is a independent on the plasma drug concentration. Constant fraction of drug will be eliminated regardless its plasma drug concentration in zero order. In the first order, the amount of drug eliminated will depend on the that is directly proportional to the प्लाज्मा ड्रग कॉन्सेंट्रेशन, अगर ज्यादा है प्लाज्मा में कॉन्सेंट्रेशन तो ज्यादा एलिमिनेशन होगा, अगर कम है तो स्लोली एलिमिनेशन. Again there is one mixed order kinetics, so that is followed by that is given by or that is depicted by Michaelis-Menten equation. Okay, so again this is a typical plasma drug concentration versus time curve showing the kinetics and dynamics after single oral dose. So suppose that you have taken drug, so on y-axis what is on y, so on y-axis your plasma drug concentration, on x-axis that is time. Suppose that you have given a drug tablet, so it will go in the stomach break and it will start absorption, drug will be in the blood, so slowly it will take absorption, will reach a particular concentration, again it will reach to a maximum concentration, then it will decrease. Okay, so this phase is known as absorption phase, this is a peak plasma concentration or Cmax. Then after that there will be a post absorptive phase, after that there will be elimination of drug from your body. This is a typical plasma drug concentration curve आफ्टर ओरल एडमिनिस्ट्रेशन. ठीक है, ओरल एडमिनिस्ट्रेशन है इसलिए वो बेल शेप कर्व है. अगर आपने आईवी इंट्रावेनस एडमिनिस्ट्रेशन लिया होता तो ये डायरेक्ट यहाँ से चालू होता, यहाँ पे एंड होता. नाउ यू हैव योर ड्रग स्टार्टेड एब्सॉर्बिंग, नाउ इट विल रीच टू ए पर्टिकुलर concentration known as a minimum effective concentration. It is the concentration of drug in the body which is required for its pharmacological action. Below the concentration of this drug will be ineffective. एक ऐसा concentration है जितना concentration minimum concentration बॉडी में होना चाहिए ड्रग का to show its pharmacological action. उसका pharmacological action दिखाने के लिए जितना minimum concentration चाहिए ब्लड में एक ड्रग का उसको बोलते हैं minimum effective concentration. और उसके नीचे अगर concentration है तो उसको बोलते हैं सब therapeutic lines. The drug is ineffective. This concentration green line is nothing but the minimum effective concentration. Or this is for other drugs. And if you talk about the antibiotics, अगर आप antibacterial drugs के बारे में बात करें तो उसको minimum effective concentration नहीं बोलते, उसको बोलते हैं minimum inhibitory concentration (MIC). For antibiotics it is not MEC, it is MIC, minimum inhibitory concentration. That is the minimum concentration required to inhibit the growth or required to kill the bacteria, okay, or pathogen. That is nothing nothing but the minimum inhibitory concentration that is applicable for the antibiotics drug. Is that clear? So below this concentration drug is ineffective, known as subtherapeutic level. Okay? Below, above this concentration drug is effective. Now see this red line. Okay? After absorption, drug will start its mechanism. It's showing its pharmacological action at this point. Okay? जैसे आपने ड्रग दिया, स्टार्ट हो गया उसका एब्सॉर्प्शन होके ये मिनिमम इफेक्टिव कॉन्सेंट्रेशन तक आ गए और यहाँ तक आने के बाद ड्रग फार्माकोलॉजिकल एक्शन दिखाएंगे. तो ये जो टाइम है, ये जो स्पैन है, टाइम स्पैन, उसको बोलते हैं लैग टाइम. इट इज नोन एज अ लैग टाइम. टाइम रिक्वायर्ड टू अटेंड अ minimum effective concentration of drug in the blood, that is known as lag time. Okay, or the point at which there is a minimum effective concentration of drug in the blood is known as the onset of drug action. And the time required to show the onset of drug action is nothing but the onset time. Okay, after that it will reach to a certain level, this red line, known as a maximum safe concentration or minimum toxic dose. It is also known as minimum minimum toxic dose or maximum safe concentration. So it is the concentration of drug in the body above which there will be toxic effect or side effects of the drug. Okay, so the concentration should be below the toxic effect, below the toxic level, below the maximum safe concentration. The concentration of drug in the body should be less than maximum safe concentration, but it should be more than minimum effective concentration. ये दोनों के बीच में ही रहना चाहिए concentration. Okay, so the concentration range between this minimum effective concentration and maximum safe dose is nothing but the therapeutic range or therapeutic window. Okay, and this was the question in GPAT again. So you should be clear about this. What is therapeutic range or therapeutic window? Not therapeutic index. Therapeutic index is different. So therapeutic window or therapeutic range. So it is the therapeutic range. The concentration range between minimum effective concentration and maximum safe dose. So that is known as therapeutic range or therapeutic window. Okay, is that clear? It was the question in GPAT 2000. Then after this absorption, drug will absorb up to a peak level. So there will be a certain concentration which is the highest concentration of drug in your body. कि आपका ड्रग एब्सॉर्ब होते होते एक ऐसे लेवल पे आएगा कि उसके बाद उसका मतलब वो हाईएस्ट लेवल है. ओके, highest level of or highest concentration of drug in the body or in the blood is known as a peak plasma concentration, or it is known as a Cmax, maximum concentration. Okay, and at this point, that is a Cmax. At this point, rate of absorption is equal to rate of elimination. After that, drug will start eliminating. Okay, so this phase will be post absorptive phase, and after that, drug will be eliminated. Okay, is that clear? Now see the vertical line. If you draw a vertical line from x-axis to up to a maximum concentration, that vertical line will show you the intensity of action. Intensity of drug is there for the action. Okay, and then if you draw a horizontal line over this minimum effective concentration, you will get the duration of action. Okay, so from this point to this point, it is nothing but the duration of action. कि आपका ड्रग कितने देर के लिए एक्ट कर रहा है, that is nothing but duration of action. और कितने efficiency से act कर रहा है, that is nothing but the intensity of action. Is that clear? So it is a typical plasma drug concentration versus time curve showing the kinetics and dynamics after single oral drugs. Okay, so what are the kinetics and what are the dynamics in this diagram? So first of all, this is a kinetics. This is a kinetics Cmax. Okay, then onset time, onset of action. Then this Cmax. Then area under curve. Whatever area is there under this curve is also kinetics. And what are the dynamics? This minimum effective concentration, maximum safe dose, therapeutic window, therapeutic range, elimination phase, subtherapeutic level, toxic level. All these are the dynamic terms. Okay, so kinetic terms are nothing but the area under curve, Tmax, then your Cmax. These are the kinetic terms. Okay, we'll see those terms again in the next slide. So what are the kinetic parameters? Peak plasma concentration, that is known as a Cmax. Peak plasma concentration or Cmax, that is the maximum concentration of drug in the blood, at which the maximum concentration of drug in the blood at a peak level, that is nothing but the Cmax, and it is expressed as a microgram per ml. Okay, now next, what is the peak time or Tmax? The time of drug to reach a peak plasma concentration, or time required to a drug to reach its Cmax, that is nothing but the peak time. Okay. Now next is area under curve. So total integrated area under the plasma level time profile expresses the total amount of drug that comes into systemic circulation. Okay, जैसे दिखा रहा हूँ, all yellow portion, all this yellow portion is nothing but the area under curve, and it will show you the amount of drug that will be absorbed in the body. Okay, that clear? That is nothing but the area under curve. Okay, total integrated area under the plasma level time profile and expresses the total amount of drug that comes into the systemic circulation after its administration, and it is expressed in the microgram per ml hours, right? Area under curve. Now next is a dynamic parameters. Dynamic parameters. So first one is a minimum effective concentration. As I have minimum concentration of drug in the blood required to produce a pharmacological action, that is known as a minimum effective concentration, below which drug will not be active. So that is known as a subtherapeutic level. Okay, and if drug is an antibiotic or antibacterial drug, it is not a minimum effective concentration, it is a minimum inhibitory concentration. Okay, so minimum inhibitory concentration is the concentration of drug or antibiotic that will require, minimum concentration will be required to kill the microorganism or to inhibit the growth of microbes. That is nothing but the minimum effective concentration. Maximum safe dose, it is also known as a maximum toxic concentration. Maximum safe concentration is also known as a maximum toxic concentration. So above which, it is the concentration of drug in the blood above which there will be a toxic effect, there will be adverse effect of drug. अगर इसके आगे अगर concentration गया blood में तो उसका adverse effect नहीं जाएगा आपको, तो it should be less than maximum safe concentration. तो उसकी मतलब वो concentration तक drug safe है, उसके आगे अगर जाएगा तो वो adverse effect देगा. Now onset of action, the beginning of pharmacological response, that is nothing but the onset. Okay, onset of action, beginning of pharmacological action of drug is nothing but the onset of action, and the time at which there is beginning of onset of action, that is nothing but the onset time. Okay, now duration of action, the time period for which plasma concentration drug remains the above minimum effective concentration, the time period up to which your drug concentration will remain in the blood above the minimum effective concentration, that is known as the duration of action, or also known as the, it is also difference between the onset time and onset drug decline back. Okay, is here. I will show you. This point, at this point your pharmacological action will start. Okay, right at this point. Okay, so here all pharmacological action is there. Okay, up to this point. Okay, so this the duration between these 2 points is known as a duration of action. Clear? Now therapeutic range, I have already discussed, or I have already told you this dose adjustment definition. So there are certain dose adjustment. So medium lethal dose and medium effective dose. So what do you mean by medium lethal dose? So lethal means to die. Okay, medium lethal dose means medium lethal dose means medium means half, lethal means die, means cause or to cause a lethal effects in the 50% of population. Here it is also known as LD50, lethal dose 50. Okay, lethal dose 50. So dose milligram per kilogram at which we can expect a killing of half of the population. For example, अगर आपके पास 1000 people है, अगर उसमें डोज देते हो आप, फॉर एग्जांपल 10 मिलीग्राम पर केजी डोज दिया आपने, और वो 1000 में के 500 लोग मर गए, तो उसको बोलते हैं मीडियम लीथल डोज. So dose required to kill the 50% of population is nothing but the medium lethal dose. And what is medium effective dose? So dose of drug effective in the 50% population, that is nothing but the medium effective dose. Now most important, therapeutic index. So it is the ratio of LD50 divided by ED50, or it is the dose required to produce toxic effect divided by dose required to produce effective dose required to produce desired pharmacological effect in the 50% of population. Means simple language, LD50 divided by ED50. Okay, it is nothing but the LD50 divided by ED50. Therapeutic index TI is equal to LD50 divided by ED50. Therapeutic index is nothing but it is an index, but it is a ratio of lethal dose to produce 50%, the dose which will kill a 50% population divided by effective dose in the 50% population. Okay, it is just a therapeutic index. It should be clear. Therapeutic index is nothing but the ratio of ALD divided by ED. Now we'll see the next. Again, zero order kinetics, as I have already explained. Constant rate process, the constant fraction of drug will be eliminated. So the rate of elimination or rate of this reaction will not undergoing the reaction. The rate operation cannot be increased by increasing the concentration. Means it is a concentration independent in case of zero order. So जैसे zero order में बोला है कि आपके ड्रग में आपके बॉडी में कुछ ड्रग है वो एलिमिनेट हो रहा है तो वो कांस्टेंट फ्रैक्शन से एलिमिनेट हो रहा है कि वो मैटर नहीं करता कि आपके प्लाज्मा ड्रग कॉन्सेंट्रेशन. So it is independent on concentration. It is also known as a constant rate process, zero order kinetics. It is given by dc upon dt is equal to kc. Okay, where k0 is nothing but the rate constant, and half life is given by t half is equal to 0.5 c divided by k. C means concentration, this is rate constant. Example: administration of drugs by using constant IV infusion. इससे आप saline देते हो, constant चलते रहते हैं. In that case, the elimination will be zero order. Okay. So if you are giving controlled drug delivery system, any formulation which is controlled formulation like implants, osmotic pumps, so that also be eliminated by zero order kinetics. Now, first order kinetics. So it is known as a linear kinetics. Okay, the rate of this kind of kinetics or reaction, the rate of reaction or kinetics will be proportional to your concentration, right? So the rate is directly proportional to the concentration of drug undergoing the reaction. Greater the concentration, greater will be the rate. Okay, जैसे मैंने बोला था फर्स्ट ऑर्डर में क्या होता है कि आपके बॉडी में ड्रग कॉन्सेंट्रेशन ज्यादा है उसका एलिमिनेशन भी ज्यादा होगा. जैसे ही आपके बॉडी में कॉन्सेंट्रेशन कम हो जाएगा रेट ऑफ एलिमिनेशन भी कम हो जाए. तो जितना ज्यादा कॉन्सेंट्रेशन है उतना ज्यादा रेट ऑफ एलिमिनेशन रहेगा, जितना कम है उतना कम रहेगा. इट इज एक्सपोनेंशियल रेट, सो इट इज डिपेंडेंट ऑन कॉन्सेंट्रेशन. दैट्स व्हाई इट इज नोन एज द फर्स्ट ऑर्डर. ओके, और इट इज अ linear kinetics. Okay, then again, what is the equation? dc upon dt is equal to kc. So k is the rate constant, and what is half life? Half life is nothing but the 0.693 divided by k. Okay, and most of the pharmacokinetic process, most of the pharmacokinetic process, absorption, distribution, metabolism, and elimination, they follows the first order kinetics or linear kinetics. Okay, and only non-linear kinetics are followed by control implants and other formulations. So mixed order kinetics, it is also known as non-linear kinetics. Mixed order kinetics are also known as non-linear kinetics. Okay, and it is described by Michaelis-Menten equation, that is for the non-linear kinetics. It is also known as a dose-dependent kinetics. It is observed in the absorption of certain vitamins, distribution of certain drugs like naproxen, and elimination of certain items like riboflavin. So mixed order kinetics or non-linear kinetics are observed in the absorption of vitamin C, distribution of naproxen, elimination of riboflavin.